So I'm just going to quickly run through the agenda and then we're going to undertake a poll just to get a sense of people's current feelings about whether they have enough information about taking the vaccine. So once we've done the poll, I'm going to introduce my fellow panelists who will be available to answer some of the questions. Then we're going to hear from Dr. Sandra Husbands, who's the Director of Public Health for City and Hackney, who's going to tell you a bit more about what data we have about the uptake of the vaccine. Then she will hand over to Professor Donald Palmer, who's going to explain how vaccines work. I think that would be really interesting to hear from a medical professional about how actually the vaccine works within the body. Then we're going to go to questions from you, the audience, and I know many of you have submitted questions in advance, so thanks for that. So that'll be an opportunity to discuss some of those questions, and that may well bring up other questions for you. After that, we're going to break out into smaller groups, probably of 20 or so people, and there'll be facilitated discussions where you'll have a chance to reflect on what you've heard this evening, and also to try and think about what we can do to give people more confidence in taking the vaccine as we move forward, or what else we need to do to build trust more generally in our health and care systems. Then everyone will feed back from each of those working groups, and if we get time, we'll have a chance to hear about the Community Champions programme, which has been supported by the Public Health Department and City and Hackney, and is invested in creating a whole range of volunteers embedded in communities and supported community and voluntary groups to help echo the right messages and provide the right information, often in their own community languages. So it's been a really important initiative. So I'm now going to introduce my fellow panelists. So I'd like them just to say a couple of words about themselves and what organisation, if any, they represent. So I'm going to go to my first of my panel members, and that's Peter Merrifield. So Peter, can you just introduce yourself?
So, sure. Thanks, Jake, for chairing the meeting and for starting it off in such an appropriate way. So hello everyone, my name is Peter Merrifield. I am the CEO of Support When It Matters. Our abbreviation is SWIM, so some of you might know us by that name. I'm a Hackney born and bred person, and our organisation is a Hackney organisation that delivers a range of services around mental health, criminal justice, substance abuse. Thanks.
Thanks, Peter. Obviously, there may be some IT issues with connectivity with people, so we'll just have to work around it. My next panelist is Jeanette Collins.
Hi, everyone. Good evening. Thank you for all coming out tonight. My name is Jeanette Collins. I am the CEO of the CRIB Intervention Project based in Hackney. And I'm a Hackney person myself. Well, actually, I live on the border now, but I'm a Hackney person myself. Our organisation helps young people get into employment, training and education. We work with families. We facilitate workshops within schools around issues that face young people in their everyday life.
Thanks, Jeanette. My next panelist is Patrick Vernon.
Hi, good evening, everyone. Patrick Vernon, local Hackney resident, been living in Hackney for about over 25 years. I have a number of hats, but I took the vaccine about nearly a month ago, and I'm working with an organisation called Ubele. We've developed a number of movement support services around this response to COVID-19, and also I've launched a fund called the Majonzi Fund, which will be launching officially in March to give out grants to families and community groups to commemorate the loss of loved ones from BAME communities.
Thanks, Patrick. My next panelist is Rosemary Jawarra.
Very good evening to everyone. Lovely to see you all. My name is Rosemary Jawarra, and I am the founder of a small but powerful grassroots organization called Be a Sheba Living Well. And we provide peer support for adults and older people affected by type 2 diabetes and other long-term health conditions. I have lived in Hackney for over 32 years, but my background is that I am from up north, so a little place called Sheffield. So if my speech and language becomes a bit confusing because I slip into all sorts of different sort of dialects or colloquial sort of metaphors, etc., please forgive me. But I do hope that you will really benefit from this presentation. I'm sure you will. And we look forward to serving you with whatever help or support or information we can. So thank you again.
Thanks, Rosemary. As a Northern myself, very proud to be. My next panelist, Toyin Adbetu.
Greetings, everyone. Good to see you. My name's Toyin. I'm a Pan-Africanist. I'm a community educator at the Legali Organisation, which is a human rights-based Pan-Africanist organisation. I'm a scholar activist, and I just like to help people kind of like deal with facts and kind of like real life and merge it all together to make it make sense. So yeah, cool.
Thanks, Toyin. Few more to go. Can I introduce Viv Vernon?
Yeah, thanks, Jake. Really positive and exciting event, much needed. Like many of the others, I'm involved in a lot of different things. I've made some notes to make sure I don't drift off, as I'm inclined to do. Raised in Hackney, left, escaped only to find myself back here as a Hackney resident. So that's probably another more profound story for another time. I'm a governor of the East London Foundation Trust, responsible for voluntary sector organisations across 5 boroughs. I've only been in a role for 6 months. I'm still getting used to that. Any input, support, guidance from yourselves would be greatly appreciated. I am also working with the Hackney Clinical Commissioning Group and a number of other organisations established the Open Minds Alliance, which is specifically focused on African Caribbean heritage communities and their mental health related needs in terms of access to data and ongoing support. Too often it's the lack of access to quality information that adversely impacts us, which is again why an event like tonight is really positive. And then the last organisation I want to reference is Black Men for Change. Really for me, important organisation to have been able to be a part of over the last year, because I've been able to draw support from that London-wide network of Black men and are working more and more closely together in partnership to bring about change in our communities. So again, thanks for the event tonight, Jake, and thanks for inviting me to be a part of the panel.
Thanks, Viv. And if people want to promote the work they're doing, please do use the chat function to do that. 2 more panelists. Can I introduce Samantha Wright?
Hi, I'm Samantha. I work at the City of London, and I'm here just to advocate also equality. We like to tackle racism wherever we are, institutionalized or outside, and it's equality across the board. And a lot of the BAME community just don't know much about the vaccine. And in the City of London, it's very diverse. So we just need to find out a bit more about that and gain some information so I can pass on.
Thanks, Sam. And over to our final panelist. I hope she's with us. Reverend Rosemary Brown. Brown, are you with us? Maybe she's not able to unmute. Okay, well, we'll come back to Reverend Brown if she can unmute at some point. So before we get into any presentations, we thought it'd be useful just to start with a poll to get a sense of, do you have enough information as an individual about taking the vaccine. So you can say yes, no, or you might not be sure. So you should see the poll on your screen now. I can see people are completing it. We'll give it a minute, give people a chance to press yes, no, or sure. And we're going to run the same poll at the end of the meeting to see if people's opinions have changed one way or the other, to see if this has been a useful session in terms of information. So the poll has now closed. So looking at that, 52% of you felt you did have enough information, 35% felt you didn't, and there are 14% who are not quite sure. So I wouldn't say it's split down the middle, but let's hope by the end of the meeting that the amount who say yes has gone up to 80 or 90%. So I'm now going to introduce Dr. Sandra Husbands, who's the Director of Public Health for the City of London Corporation and Hackney Council. Sandra is going to give you some information about what data the health service has about uptake of the vaccine. So can I hand over to you, Sandra? And I believe you've got a slide that your colleague's going to get up on the screen. Over to you, Sandra.
I'm not going to talk for very long. Really what I want to do is just set the context for the conversation by just showing you some of the data, but I won't be showing you that. I won't really be showing you anything you don't know.
Quite quiet, Sandra. Is it possible you could speak louder into the mic?
Yeah, I'll just get a bit closer to the microphone.
Thank you.
I haven't got my mic, my head mic plugged in because the headphones were squashing my ears. I can put it on if I'm too quiet. Can you hear me now?
Yes.
Okay. So I'm not going to talk for very long, but I just wanted to show you this one slide because it just helps to set the context for the conversation. We don't really have a lot of data about the vaccination program at the moment, so I can't really share a lot. But what we do know is that in terms of vaccine uptake so far, we're already seeing some disparities. Just a second. I'll just put that on. It saves me having to shout. Is that better? Right. Okay. We're already seeing some inequalities. So we're seeing that that white people in each of the priority groups that have been already invited for vaccines. So that starting with the over 80s, then the 75 to 80s, then the the over 70s, and the people who were clinically extremely vulnerable. So those are the groups that we have already mostly completed vaccinating. That there's been much greater uptake from white residents than Black or Asian origin residents. And I know that when we talk about ethnic groups in those big categories like that, it doesn't give you a lot of detail, and that just calling people white also obscures a lot of ethnic minorities within the white group as well. But what we're clearly seeing is that Black residents in particular are not taking the vaccine as much as white people are. Now, I'm deliberately not saying that they're reluctant to take it or that we're hesitant to take it, because we don't exactly know what all the reasons are, but we do know, because we did some insight work, that a bit like the poll that we just had, that a lot of people were unsure and that they wanted some questions answered and they wanted some good information before they made up their mind about whether or not they were going to get the vaccine. And some people are just waiting to see, because even though quite a lot of people have been vaccinated, it was in a very short period of time relative to a normal vaccination program. So what this is telling us, this slide, is that what we've seen, the likelihood of accepting the vaccine. This is from the a lifestyle survey where people expressed their opinion about it. The likelihood of accepting it was lowest among Black people, and then that's been mirrored in the uptake we've seen locally. But you'll also know, most of you will remember, that we also had, certainly in the first wave of the pandemic, the worst outcomes among Black residents who caught COVID. We had disproportionate number of people catching it from the Black and Asian communities in Hackney, and more of those people from dying who caught COVID from those communities than from the white community. So we really do need to prioritize the prevention for people from Black and other minority ethnic communities. And that's why the vaccine is so important, and hence this conversation today. So that's really all I'm going to say. So, and that gives plenty of time for Professor Palmer's presentation and then for people to ask questions.
Thanks very much, Sandra. And I believe you're going to be on the call as well. So, and there are a range of GPs who are going to be in the breakout rooms who can answer some of your technical questions. But if you have questions for Sandra and our next speaker, Professor Palmer, we'll be able to take some of those. So can I now invite Professor Donald Palmer, who's the Associate Professor of Immunology at the School of Veterinary Science, I believe, the Royal Veterinary College, sorry. Professor Palmer, I know you're going to be talking to us about how vaccines work, and you've got a shortish presentation. So can I hand over to you, Professor Palmer, and thank you both for giving us your precious time tonight. You're on mute at the minute, Mr. Palmer, so if you don't mind unmuting.
Okay, and I believe I sent over my presentation to the organizers. So as I don't have the shared screen facility, I'm hoping, or I could share it myself. It's entirely up to you how you.
I think Claire is going to share it. Claire,
okay.
can you put the presentation up?
So firstly, I'd just like to thank the organizers for inviting me today. I've been an immunologist now for over 35 years. And just to share briefly with you, is that I've actually sat on one of these independent regulatory bodies. So I was on the Medicine and Healthcare Products Regulatory Agency, which is a short term for MHRA, which perhaps many of you have heard about. So I was on that regulatory body, specifically looking at yellow fever. So I've experienced what that body is like. And just to say that it is an independent body. So I was asked to come in to look at, they had 1 or 2 adverse cases of yellow fever. And so they brought a panel of experts to discuss it, to look at the data. And that actually also included members of the public that were part of this regulatory body. Okay, so I'm not sure if my slide's coming up, but in the interest of time, I can just go ahead and talk about really how the immune system works. Okay, now the key thing about our immune system is that our immune system is absolutely vital for our protection. What's really important about our immune system is how do we get infections? How do we become infectious? Okay, and so one of the key things about when we become infectious is the routes of which infections can occur. And in general, there's about 3 or 4 routes. One is when our skin gets cut, so microorganisms, bugs can get in. The other way is when we ingest food, food poisoning. And the other way is through what we call the nasal pharynx system. Okay, that's when basically things like flu, and what we're talking about is COVID. So when we look at basically our own immune system, and I don't know if anyone can put this on a slideshow, just so that you can see it in a larger format. Basically, we have various barriers of sort of a protection. The skin is a major barrier. And there's also the mucus that lines our sort of nose and nasal pharynx system is also, a protective barrier. Even the tears in our eyes have actually got activities that prevents us from getting diseases. And don't forget the acid in our stomach. So that's what we call our natural defenses. But if we are going to sort of fight particularly viruses and bacteria, we need the white cells in our body to actually make immune responses. And you may have heard the term T cells and B cells and antibodies. So T cells and B cells are basically part of our white blood cells. And the soluble proteins that B cells produce are antibodies, and antibodies are really important. So if I go to the next slide, I really just want to tell you about how our immune system fights against viruses and why viruses can sometimes make us ill. So the key thing with viruses is that how viruses work is viruses attach themselves to our cells. So we're all made up of cells. So what they do, they bind to cells and subsequently they get inside the cell. Once they're inside the cell, they're using the cell machinery to actually make its own particles. Now, what's really important, therefore, it causes cell destruction, and that's what makes us ill, okay? Viruses destroy our cells. So what's really important is that we have our immune system, and particularly antibodies. Antibodies coat these viruses, so prevent the viruses from getting in. All right, so once you've made your antibodies, you coat the virus so the virus can't get into cells. Now, what's really important then is how and why and when we make these antibodies. That's really important. So when we see a virus or a bacteria for the first time, we don't make antibodies initially. It's normally our natural immune defenses that are actually trying to encounter any infection. These important proteins we call antibodies actually take a bit of time to come, take a little bit of time to be made. In fact, it can take maybe up to 1 week or even 10 days. So you're relying on your natural defenses. Now, this is the problem. So the time it takes to make these antibodies vary. It varies in terms of diet, varies in terms of age, and so forth. So in order for the body to make these antibodies, what is necessary sometimes is why we use vaccines. Because what the immune system does, and which is why I found it fascinating, is this idea of memory. It remembers every time you make an immune response. And what it does by making that memory is what's called it's priming itself, it's boosting itself. You know what it's like if you're going to visit a venue for the first time, you may not sure where it is, you get lost. But once you've gone several times, you know how to get there. The route is quicker. And that's how the body's immune system works. It remembers every time you make an immune response, particularly to that same virus. So what happens therefore, and what vaccines are doing, is vaccines are boosting your immune system so that it's already now got these antibodies. All right. So we've now managed to get there. Brilliant. Next slide and press that. Yes. So that's basically what vaccines do. They boost your immune system, make your antibodies ready. And that's how vaccines work. They're invariably harmful substances of the organism that are preparing and boosting your immune system. Next slide, please. If I can get to the next slide, that would be great. Don't know. Yes. So here's an example of measles vaccination. So we may have forgotten about measles. Measles is now a disease that is more or less removed from society. There are 1 or 2 hotspots, but here's an example of how the importance of vaccination. and what you can see in this slide, the introduction of vaccines has more or less it led to the eradication of measles. And anyone that was around in the 40s and 50s can tell you what measles was like. It was a terrible disease. WHO reckoned that vaccination per se, and there's loads of vaccines. We could talk about TB, we could talk about a whole host, polio, etc. But vaccinations have led to the increase in lifespan for many, and there's also an increasing number of population for a few million. Next slide, please. And so the whole concept of us being vaccinated is the idea that we can generate what we call herd immunity. And let me explain that to you. It's the idea if there's only 1 or 2 individuals that have been vaccinated that are protected, what happens is the disease is allowed to spread and can continue to spread. But if most people get vaccinated, what then happens, the likelihood of people that can carry the disease or spread the disease is limited. What's quite interesting, it doesn't mean everybody has to be vaccinated, but a significant number has to, which is why many of the diseases that are around in the 40s and 50s and 60s are more or less been eradicated. And another example is smallpox. Next slide, please. So I just want to spend the last couple of minutes talking about how medicines in general are made. And the fact that how medicines are made is that they first start off in a laboratory where they're being tested. And then they go through various stages, maybe computer modeling, and what we call cell lines, cells that can grow in a lab that you can test. And eventually they move on to animal studies, and then subsequently onto human studies. These terms what we call phase 1, which is a small number of people, then phase 2, which may be about 100 people, and then phase 3, which could be up to 3,000. Just to tell you how it all works. And then you have regulatory bodies that will now look at all the data and therefore then establish if this drug is safe. Now in the Q&A, I can talk to folks about why is this vaccine taken so quickly, areas about has this vaccine been tested on a wide variety of people, and I can tell you more a bit about how vaccines work in general. But for the interest of time, I'm going to stop there and again thank the organizers for inviting me, and sorry for the mix up at the beginning, but I hope I've shed enough light around the immune system and vaccination. Thank you very much.
Thanks very much, Professor Palmer, and apologies for the IT glitch there.
That's fine.
So I believe there are some questions that came ahead from members of the audience, and perhaps if we take a few of those first and then look to the chat box for questions from the audience. So Toyin, I believe you were going to read a few of the questions that have come in advance. Would you like to read a few that you think are relevant to in response to Professor Palmer and Sandra Husbands?
No problem, thank you. Okay, there's a few questions that come in. One is about the safety and long-term effects. So this one reads, my worry is about the likelihood of developing long COVID symptoms from the vaccine, much in the way that those who've had it have done so. I don't feel like the vaccine has been around long enough for this possibility to come to light. So they basically want to know, is it safe? How can we know that we'd be safe from developing long COVID symptoms?
So I can answer that, and I suspect, love to get the GP's perspective on this, because I can take it as a basic immunologist. Now, I should point out, one of the reasons is how you get disease. So let's take a step back. You get disease from bugs, what we call microorganisms. They're the ones that give you disease. The key thing with these vaccines currently that are under emergency use is that, particularly the one for the messenger RNA, it actually doesn't contain the entire microorganism. So it only contains a small portion of the microorganism or the virus. So whereas it mimics the immune response so that you can make these protective antibodies, it doesn't actually give rise to the full scale of disease that you see with COVID. Okay, so there's a real difference here in that what viruses do is that they mimic. Now, there are some viruses which actually contain an actual organism. We call those live attenuated, where they've been grown so that they don't cause disease. But these current vaccines are very different in how they've been made. Okay, in terms of their safety, I think it's really important is that they've gone through the same regulatory and safety procedures as any medicine that you are actually going to be taken. All right, so that's really important. And I should add, one of the reasons why people may say, well, vaccines, they take, 5 years, or medicines in general, why is this so fast? And there are a number of reasons that I think it should be mentioned. One is that the platform for making these types of vaccine has been around for a number of years. Okay, so even the rabies vaccines, the technology was using messenger RNA technology. Okay, the Ebola vaccine has been using the vector one that's done by AstraZeneca and Oxford. So these vaccines and the technology has been around for a long time. But one of the major breakthroughs is the collaboration that's taken place amongst many scientists, not just national, but international. The sharing of data. So a large number of collaboration has taken place. The amount of funding that's been given for scientists to conduct these experiments, these early stages. But one of the most important things why this was much quicker was the fact that, as I mentioned before, when we're looking at drugs that are going to be used in human use, they go through what we call phase 1, phase 2, phase 3, and regulatory body. That's basically where a lot of the time is taken up. And what's happened in this case is they actually did them literally simultaneously. They did phase 1, phase 2, and phase 3. Not only did they do those all together, they also submitted the data to the regulatory body as soon as they received it. Equally important, and I think this is what if people want to know more, is they also published this data literally online. So what you find is that most scientific journals are published in libraries, and to get access to them, you've got to be part of a university, etc. A large number of these publications were made freely available, what we call open access. So I'm aware that the Lancet published a whole host of material online. Some of the clinical trials for Moderna and AstraZeneca are freely available. So I would suggest people have a look at those. So in order that they can, come to a decision. But that's one of the major reasons why this vaccine has been done as quickly as possible. But the safety has not changed.
Thanks, Professor Palmer. Toyin, a couple more?
Okay, just a couple more. What I'm going to do, I'm not sure we kind of covered the query about long COVID, which is what the questionnaire seemed to be more concerned about. But I'm going to roll up the next two questions into one. So it says, is there research on how the vaccine was trialed and how diverse was the trial for different illnesses? And are some people of different ethnic groups more prone to illness? And the second question, which is linked, is if you look at the statistics for the Caribbean islands, the highest death rate has been in Jamaica with approximately 350 deaths in total. The other island death rates number in double digits. So why are people of African heritage disproportionately dying in the UK and North America and not in the Caribbean? And they say the answer cannot be sunshine and vitamin D. India's hotter than many of the Caribbean islands, and they also have a high death rate. So I've just rolled those two questions into one.
I can answer from the scientific, but I think part of this is clearly down to the disparity that's been identified around poverty and structural racism. That's where I see, but perhaps social commentators and whatever may want to comment on that front. I can comment more on the the question around clinical trials. So Moderna and Pfizer clinical trials were taken involving, in some cases, 30,000 people. So it should be pointed out that for most clinical trials, most drugs that we currently take, a phase 3, the end trial, is normally done on 2,000 to 3,000 max. What was quite interesting is that these trials for the vaccines involved almost a total of 100,000 people. And what's quite interesting is that some of these trials involved people from diverse backgrounds. So in the Moderna trial, they involved African Americans, involved Hispanics. What's quite interesting with the Moderna trial, and I know this with the other trials, is that up to 15 to 20% of people have different ailments. So some are obese, some have got cardiac disease, etc. And in fact, in my presentation, which I can make that freely available to anybody, there's a list of the demographics and characteristics of those individuals that were taking part in those clinical trials, which perhaps the council could make that available.
Thanks, Professor Palmer. I'm going to come to Jeanette in a minute, who's also got some pre-sent questions, but I think let's look at the chat function. There's a few really helpful and interesting questions that have come through. I can see one from Lucy Carter. Could you explain why patients feel they have flu after the flu vaccine? And could this be the same for the COVID vaccine? I'm wondering who might be able to answer that. Sandra, is that something you could answer?
I can answer that, but I thought maybe Donald might want to answer. It really is that when you have a vaccine, and almost any vaccine actually, you will have an inflammatory response, an immune response to it, that will be a sort of systemic response as opposed to just a local response. So if you get an infection, you'll usually just feel symptoms at the site of the infection, like your throat or your nose to begin with, before it spreads. But when you've had a vaccine, obviously it's been injected and it will circulate. And that's why you'll end up quite often feeling as though you've had some sort of systemic thing like flu. Your muscles ache, you feel tired, you might even have a bit of chills. And people are getting that with COVID vaccine, just like they can get that with flu vaccine. And that's a perfectly normal adverse side effect. Not everyone gets it. Actually, you're more likely to get it if you're younger. And Professor Palmer could probably tell you all the reasons why about the aging of the immune system, because that's his particular specialist area, but we probably haven't got time for that. But yeah, so that is why people feel like they have flu if they've had a flu vaccine, but it's not flu. It's an inflammatory reaction in response to the vaccine, and you'll get a very similar side effect sometimes with the COVID vaccines too.
Thanks, Dr. Husbands. And there is a sort of linked question to that, is that what are the side effects? Are there any other side effects that are worth mentioning? You might want to put on your headphones again, Sandra, so that we can hear you well. I know that it's a bit of a pain, but we can hear you so much better with those on.
Sorry, I just have very delicate ears, obviously. So there are a number of side effects, and they range from very sort of minor, like pain or tenderness around the injection site in your arm, to that kind of all over body aches type feeling of flu, and almost anything in between, chills, headaches, muscle aches, joint aches. Those are the common ones. And as I said, not everyone will get them, but around 1 in 10, or maybe more than 1 in 10 people in the trials got those side effects. And the MHRA is monitoring side effects in people who are being vaccinated in the vaccination program. And as you know, 15 million people have already had at least one dose of vaccines so far in this country. They published some data earlier this month after 7.5 million, looking at the data from 7.5 million doses, and they'd had something like, if I can remember the numbers right, about 45,000 reports of side effects, and they were all of that nature, except for the two that you may have heard about in the news, allergic reactions that people had to the Pfizer vaccine very early on. So some people, and people that with allergies will be allergic to something that's in the vaccine. With the Pfizer vaccine, there's a component in it called PEG that is a known allergen. But apart from that, neither one of them has anything else in that is particularly likely to spark an allergic reaction. And in fact, MHRA has recently changed its advice, and it's not advising people to avoid the Pfizer vaccine unless they know that they're allergic to that component of it. They were for a few weeks advising people to only take the AstraZeneca vaccine if they had severe allergies to anything. You know, it could have been a food allergy or bee stings or whatever in the past. If you had an anaphylactic type reaction and carried an EpiPen, you're being advised to avoid it, and they're no longer giving that advice. But you do need to discuss your allergies with your healthcare worker before you take the vaccine.
Yeah, I can make a comment just on that, because what Dr. Husbands says is absolutely right in terms of the side effects around sort of swelling, tiredness and headaches and fever. And maybe I didn't, and I apologize if I didn't make this clear, but what the vaccine is doing is mimicking an immune response. And I want to make it clear to the audience is that the idea of getting a fever or swelling, that's actually the body's response. So one of the things we know about when your body increases the temperature, that's the body's response in actually trying to remove the microorganism. Microorganisms in general don't like high temperature. So that's a natural body's response to what it perceives as an infection, all right? But clearly having a higher temperature for a long period of time can be clearly detrimental. So what vaccines do, and all vaccines do this, as someone mentioned, like the flu, it kind of mimics that response. And as Dr. Husband says, which is really important, is that perhaps we're aware some people have had the vaccine or whatever, and their response will incredibly vary. So some people may get these, others won't. But so far, as Dr. Husband says, almost 60 million people that have been vaccinated have been sort of looked at. And in terms of the allergic reaction, Dr. Husband is right. If you've got severe allergies, do talk to your GP. And these vaccines are predominantly, and the ingredients are available, are literally made of mostly of water. They're made up of salt, sugar, some small amount of protein and lipid. That's the sort of main ingredients. And obviously the ingredient like the messenger RNA or the vector, that's going to give rise to the immune system. But overall, the most component is water.
Thanks, Professor Palmer. Really interesting, and didn't know that myself. There's some questions in the chat that I think are a natural follow-on to what you've just said. And Anushka has said, there are so many different vaccines. How do we know which is the best one to take?
I guess it's not necessarily the best one. I guess it's the one which is the most safe. As well as the one which is the most efficacious. So the whole idea of developing these vaccines was making sure they actually work. So a number of individuals, a number of countries are making vaccines. I recently read about the Cuban vaccine, which is now going in clinical trials. So the whole idea is to develop these vaccines to find out which will be the most useful, and therefore, more importantly, which is the most safe. And that's really the structure of which they're going. So that's why various groups, and they're also using different approaches. Yeah. And that's why there are many that are currently being developed and investigated.
Can I assume that people will not have a choice, in fact, and it's based on, when you get that text from the NHS that says you've now received the vaccine, you won't have choice, right?
That is right. There won't really be a choice. There would only be a choice if you were allergic to a component of one of the vaccines, for instance. But what how it's working at the moment is that the vaccination centre will have one or other of the vaccines. And actually at the moment, simply because of the supply chain, there's just a lot more of the AstraZeneca vaccine around than there is of the Pfizer BioNTech vaccine. And so you get invited, you go along to the centre, you get given whatever vaccine there is. So generally, you're not getting a choice. At the moment, there are only two. So although the Moderna vaccine has also been approved for use in the UK, it won't be available for another 2 or 3 months. So there are only two. And at the moment, the AstraZeneca one predominates. So that's the one you're most likely to be offered.
And how will you know if you're potentially allergic to the ingredient?
Well, the ingredients are available. If you look on the, if you Google coronavirus vaccines UK or something like that, an NHS website comes up and it actually tells you what the ingredients are. The main allergen, though, as I said, is something called polyethylene glycol, or PEG. And if you've had an allergic reaction to it in the past, you would know usually.
Okay, thanks, Dr. Husbands.
Jake, there's still some questions that have come in that might lead on to these ones that are actually being posed right now. So I just want to just group a couple more together because they're quite important. We have one here that says, why are vulnerable groups such as pregnant women, those on medication, or those who suffer from sickle cell being encouraged to take the vaccine when it has not been tested on these groups of people and therefore there is no evidence that it is safe for them? That's one. And the second one I'm going to link with that one is, since protection is not assured after one is vaccinated, why not instead embrace a healthy homeopathic way of lifestyle? There's still several questions, but those are two I thought tie into what we've just been discussing.
Okay, I can answer the protective one. So there's recent evidence to show, in terms around the protectiveness of the vaccine, that it appears to protect, and then particularly it appears to show a reduction in the severity. There's still more evidence needed, but there are now some studies coming out to show is that antibodies are definitely produced. So people have studied those. Those antibodies have been shown to be effective, and when people have been looking at the level of hospitalizations in individuals, they're seeing a reduction in hospitalization and also severity of disease. One country which has shown this is Israel, and Israel have been vaccinating a large proportion of the population. There's also some limited evidence in the UK amongst older people, but more data is still required to validate that.
Thanks, Professor Palmer.
That's one part. What was the other part?
Why are vulnerable groups such as pregnant women, those on medication, or those who suffer from sickle cell being encouraged to take the vaccine when it's not been tested on those groups of people, and therefore there's no evidence that it's safe for them? I also saw something in the chat that linked into this.
I can answer that in part.
Yes, please.
In two parts. So the first part is that some people who were on medication and have underlying conditions were included in the trials.
Yeah.
And I can't say whether any of those people had sickle cell disease or not with any certainty, but they definitely didn't exclude people from the trials on the basis that they had underlying conditions, because that was the whole purpose of trialing the vaccine, was to determine whether or not it was going to, not just whether it would prevent COVID infection, but also whether it would reduce the impact of COVID infection. And we know that it has the most impact on people who've got underlying conditions. It is normal practice not to recruit women who are pregnant into clinical trials. But as it turns out, a number of women did get pregnant during the trial phases of these vaccines, and no harm came to them or to their babies. So it's usually not specifically recommended to vaccinate women during pregnancy unless there is a known risk to the mother or to the baby from the specific infection. So pregnant women in general are not being encouraged to get COVID vaccine, but unless they are in a high risk group. So if you are in a group who, if you weren't pregnant, you would be at high risk if you caught COVID, you are still being encouraged to get vaccinated even if you're pregnant. But most pregnant women are being advised to wait until after they're pregnant, till after their pregnancy's finished, in other words.
Okay, thank you. We've got 15 minutes left and we've got loads of really good questions coming in. So I'm going to try my best to see if we can address most of those. So we've had a question from Natasha Julian. Will the vaccine still be effective if you've already had the virus? And what's the chance of getting COVID twice?
So the evidence suggests that you will make a response to being infected by COVID, but whether or not that protection is long lasting is the major concern. Whereas with the vaccine, it seems you are making what we call long lasting immunity. So what's being suggested is even if you've already had COVID, it is still worthwhile getting vaccinated.
Okay, good advice. We've had some questions about the actual vaccine sites themselves and what are the social distancing protocols? Can we assume that vaccine sites will be safe?
Oh, I mean, in terms of the vaccine, again, Dr. Husband can comment. So far, even when you get vaccinated, studies are being done at the moment, but no one still is not clear whether you get vaccinated, although there's evidence now that there's a level of protection, there's a reduction in severity of disease. People who are vaccinated, it's still not clear if they will still carry the disease and transmit it. There's some evidence that there may be lower transmission, but the data's not out there yet, which is why even when you get vaccinated, you still should operate social distancing, wearing a mask, etc.
Okay.
That's absolutely right. Although I think that the questioner was asking about, is it safe to go and get a vaccine? As in, I won't catch COVID from somebody else while I'm at the vaccination site. And if that's what you were asking, they are being run in COVID secure ways where there's, so basically it's one of the reasons that people are being asked to book and you can't just walk up and have a vaccine is because it helps the organisers to manage both the timing and the queuing so that they can make sure that the place isn't overcrowded, that there aren't people waiting around for too long, that there's minimum opportunity for people to mix. And then all of the staff are wearing PPE. All the staff you'll come into close contact with will be wearing PPE. And there'll be some volunteers who'll kind of shepherd people around to make sure that, you know, the one-way system is maintained and things like that. So, and of course, everything's cleaned routinely and regularly in between patients. So yeah, hygiene is good and social distancing is good. We actually have a little video about it on the Hackney Council website, which I wish I could remember the URL, but if you go on there, I'm sure you'll find it, and you'll see somebody doing it, basically a journey through getting a vaccine. It might set your mind at ease, but it's the locations themselves, the sites themselves, are not places where we're expecting to have crowds.
Thanks, Sandra. Some concern about people who've maybe died as a result of taking the vaccine. Is there any evidence of that, and what's the data saying?
So there was a report a few weeks ago about a number of people in Norway who, without trying to sound like I'm being dismissive or ageist, but they were old people living in an old people's home who died. They'd all been vaccinated and they all died fairly shortly afterwards, like a week later or within a week or something like that. And so it did cause concern, but it was looked into both by their own national public health agency and also by the WHO. And they both independently concluded that that number of deaths in that home in people of that age in that time frame was not an unexpected event, and that it was just a coincidence that they happened to have been vaccinated a week or two before. There have been no reports of people dying in relation to taking the vaccine. Of the 15 million people who've been vaccinated in the UK, none have died in relation to that.
Okay, that's really reassuring.
There is a question, Jake, in the post, and it's also in the questions that was sent ahead, which reads about, my grandmother got the Oxford vaccine recently and had some really awful side effects, including headaches and wheeziness. So the question here is, what aftercare is there in place for situations like this, as GPs don't seem to have a clue? That's obviously not my language, that's there. Yeah, so I think they kind of would like an answer to that, because that's a personal observation.
Well, I can't really speak to the fact that that person's GP didn't seem to have a clue, and that's very unfortunate. I mean, basically, if your side effects are severe enough that you feel like you can't manage, what you should be doing is calling your GP, or calling 111, who may then put you through to your GP. But basically, if you can't manage, get medical help, because it doesn't necessarily mean that the side effects are severe enough that it's going to be serious, but you should be looked after if you can't cope.
Okay, thank you. Some more questions coming through in the chat. Most recent one, which I think is relevant, is, my mother has had the COVID vaccine and I've also had the vaccine. Is it safe to visit her indoors whilst maintaining social distancing?
It's not a matter of whether or not it's safe, it's that it's not permitted if she's not already part of your support bubble. So until we're out of lockdown, no visiting.
Okay, that's a pretty straightforward answer. Another question about, if you've had one Pfizer vaccine, is your second dose then the same brand of vaccine? I'm assuming the answer is yes.
Yeah, it is. There's actually a trial starting at the moment looking at mixing the doses to see what impact that has. But actually what's happening for people who are being vaccinated as opposed to in a trial is that you'll get a follow-up dose of the same vaccine that you had the first time.
Okay, thank you. I'm conscious that I haven't invited my fellow panelists to contribute or ask questions. Can I ask if any of the panel have questions or comments they'd like to make? I know
I've got one.
Yeah.
I've got one, Jake. Yeah?
Yep.
It's in the chat. It says about the rough sleepers. Are the rough sleepers being vaccinated? Are they going to be a kind of a priority as well to be vaccinated? Because you've got it's in one of your questions down in
Thanks,
Yeah.
Thanks, Jeanette. That's a really good question. Sorry, I didn't
Yeah.
see it in the chat, but it's a great question. Thanks for bringing it up. Yes, they are. So after a bit of petitioning, the Joint Committee on Vaccinations and Immunisations, JCVI, has included homeless people in the priority groups. So they were included in priority group 4, which is like the clinically extremely vulnerable, and we already have started vaccinating homeless people in our area.
Well done. Thank you.
Sandra.
I've got a question, Jake, if that's all right.
Go, Peter.
My concern, I suppose, is what's the thinking or planning for protecting members of our community who choose not to have the vaccine, and the potential backlash that this could bring from the public, the impact on their jobs, whether they'll be able to go into work if they're care workers. And I'm quite concerned that there's a sense of a build-up that if you don't have it, you will be ostracized or be blamed if there is continued infections.
That is a good question. At the moment, and for the foreseeable future, not only will the vaccine not be mandatory, but individuals are not required to disclose to their employers whether or not they've had it. So although if you work in the health and care sector, you are being very strongly encouraged to have it, just like every year we strongly encourage them to have flu vaccine, if they choose not to have it, that's their prerogative. And we actually, we only know that, you know, we've got a proportion of our workforce vaccinated or not vaccinated, but we wouldn't necessarily, as an employee, wouldn't necessarily know which ones were or weren't. Many of them will, you know, they don't necessarily get vaccinated through work. So the employers aren't really in a position to do anything about it. I had heard about one independent care home or care provider, I should say, not in this area, that was trying to write it into people's contracts. And I think well, I don't know what the legal position is on that, but I do know that the Secretary of State spoke out against it as an approach to getting people vaccinated. So it doesn't look like that's what's going to happen. So if you're vaccinated or not vaccinated, your vaccination status is your personal business, just like anything else to do with your medical history, and people won't know that about you. Having said that, constantly talking about Black people not getting vaccinated is a way to create a narrative around the Black community that, oh, these people just won't look after themselves and they'll be responsible for spreading infection. So just like when you see stories like, oh, right at the beginning of the pandemic, we know we had people saying, oh, it's Chinese people, they're all to blame, and there was some hate incidents against people who people thought were Chinese. So I think we have to be very conscious of not creating a stigmatizing narrative, while supporting people to make their decisions, their own personal decisions about what they do to protect themselves.
Thank you.
Do you have another question, Peter?
No, that's fine, thanks.
Okay.
I've got one, Jake, if that's okay.
Go for it, Vim.
And that was a great question, by the way, Peter. That are really critical question that I think is going to come back again as this whole thing rolls out. The question I wanted to ask is in relation to young people, because this is a really, really good event, and I've seen many others taking place, but not targeted at the young people in our community. And I'm very aware of their susceptibility to conspiracy theories and the potential for them to pass it on to the elders in our community and so on. So I just wondered what your thoughts are around what needs to be done in relation to providing them with the kind of information wrapped up in the way that they can digest it that's taking place here tonight.
Well, from our point of view, from the local authority and the public health point of view, we are doing some work around creating some communications content, and that can go out on channels and through the means that will reach young people, including through grassroots channels like through our Young Black Men's Network, for instance, but also making sure that we're making use of things like social media and easy to digest content. There's some other work going on elsewhere around the country, and we'll just make use of that as well.
Yeah, I'd like to comment, and I think what Dr. Husband said is right, and this is a really good question because my dear colleague, Dr. Winston Morgan, who's a reader at toxicology at University of East London, has been writing quite a lot about this area, where it's a mixture of anti-vaxxers and right-wing individuals are targeting the legitimate concerns that the community has, and so I think what's needed, and that's why I'm glad that I'm appreciative of contributing, is for us to have that conversation so that we know what the facts are, so that we can make an informed decision. And I think what we need to do collectively, so that we can, help our young people in particular, is to be discerning. So it's important that we are critical to people like myself, ask questions, but we also need to do the same with information we get on social media, to ask, look, where's this come from? Because there's evidence to suggest that our community is being targeted deliberately. so some commentators feel. So I think that's a really good question, and I think it's where we have these discussions and this narrative that it's an area that I'm really concerned about.
Just to follow up, going back on it, because I experienced it with my own son, who at the beginning, you know, he and I found ourselves in the same space after God knows how many years. And it was only as a consequence of he and I sharing the same space that I realized that he'd begun to take on all of this stuff. Now, the fact that he and I were in the same space meant I could work on him over a period of weeks and get him to a point where he began to, you know, use the critical thinking tools that I'd already embedded in him as a young man. And that's, I mean, I felt really bad about the fact that that had been able to happen under my nose, because that's happened to people that are closest to you, you're looking over. But there's not enough of that taking place, and our young people are quietly being targeted, as you've rightly said, and then recirculating that information in our community, because they are much more adept at using social media to get information all over the place.
And Viv, that's perhaps where our community and equally government may need to look at that, because even from the summer public health report, Professor Kevin Fenton spoke about making sure communications of a certain narrative to a certain demographic. And I guess what's happened is we collectively have taken our eye off the ball, and now this large amount of misinformation has been circulating. And so I think someone mentioned, it may have been Jake or whatever, someone mentioned this, is now what's needed is, we can't just have this event once. This event now, by various people, need to continue, because basically we're behind the curve. There's been a period of where there's been a lot of misinformation, and it's now, okay, let's now make sure we can get the facts. So I see this as a concerted effort.
I think that's right, but I think we also need to give ourselves a bit of a break. So we're behind the curve for a reason, which is that there was a lot of misinformation circulating about vaccines before there were any vaccines. So we didn't have a counter narrative until quite recently. But that doesn't mean we can't catch up. And I think that point about critical thinking and helping people to just interrogate what they're hearing and fact check effectively is what needs to happen. And that's what the purpose of these sorts of things is, not just to talk to people and say this is what it is, but also to tell people that there are credible sources of information and that there are ways to find out if something is credible and legitimate or not. And then you can look for yourself, find out for yourself.
Okay.
Yeah, I was going to add something actually.
Patrick?
So I think part of the challenge, part of the nature of this event is using the information that we know. We know there's lots of mistrust in the community, and to just have that dialogue. I mean, in my family, my parents, my dad's 89, my mom's 87. In December, Christmas time, while we were having an online social Christmas dinner, because I couldn't see them, live in the Midlands, they didn't want to take the vaccine at all. And then over a period of about a month, we had a family conversation. We shared information, NHS websites, and then I was given the early opportunity to take the vaccine, which I did take, and then my parents took it a week later. My sister, who works for the NHS as a nurse, took it. So about a third of my family have taken it, and everyone now is really willing to take it, because the bottom line, as what you've heard from Sandra and Donald, it's about saving lives. So, but we all recognise that the role of social media and the way that it's being played against the community, we have to speak out. And that's why there's lots of people putting stuff on social media, doing videos, communicating. And I think it'd be fantastic if there's a community video made and targeting those parts of the community who are vulnerable to a whole range of misinformation. I think that's a key thing that we can all do, basically. I think it'd be really, really powerful. Just one short anecdote. A friend of mine who's a journalist, his next door neighbour is 81-year-old from Trinidad. About 2 weeks ago, he refused to take the vaccine. He refused. I'm not taking that vaccine. They're going to experiment on me. After a series of conversations, and he saw a video of me talking about why I took it, what the importance of it. Yesterday, he took the vaccine. we have to have that community conversation, the family conversation in the churches, in the mosque, everywhere. And one of the sad things about this whole issue about the pandemic is the lack of investment in the community. I've worked in public health. There was a time there was a lot of money around public health funding community groups, and it's like lastminute.com that this money's been given to do this stuff. So I think coming out of the pandemic, it raises the fundamental issue of tackling health inequalities, better communication, and the work of CVS and other organisations to fund community groups to do the legwork, which the government has neglected for far too long.
I'd just like to add on to that.
Can I follow on as well before you speak, Toyin, because I didn't get a chance?
Okay.
So just to finish up there, just after that, do you think the Black community or the Asian community are deferring taking this vaccine because there's no continuation or no decision on travel? Also, there could be some discussions around going out properly, clubbing and socializing and so forth. Do you think they're waiting until the last minute until they have to really take this vaccine? Could that be a drive?
I think people are waiting. What we're hearing is people are waiting to see. So, there's a lot of uncertainty because even though there were a lot of people in the trials, they just are less confident about the outcomes of the trials because they just feel as though it's all done very quickly. And I just, even that question about long COVID, well, we haven't had long enough to see. Actually, we didn't really answer that properly. I'll come back to that in a second. Yeah. So I think that the reason that I think some people are deferring as opposed to just refusing to take it. I think they're saying, I'm waiting to see. Some people are actually just still nervous about what the impact will be on them as well. So that's what's driving it, I think. And then, of course, there are also just some really practical issues like there are for every community. But I'm not sure about the travel or nightclubs. It actually really wouldn't serve you if it turned out that there was some kind of international vaccine certificate that you required for travel to certain countries like you do with yellow fever. You would have had to have had your vaccine far enough ahead of travel for the country to for your vaccine certificate to demonstrate that you had developed immunity. So you couldn't get it just the week before you went traveling or anything like that.
Okay, thank you.
Sorry, can I just come back to that long COVID point, Jake, because we didn't really answer that. So it is an interesting question. I think that Donald's point about you can't get the disease from the vaccines is right, because you can't get COVID from the vaccines because they don't contain the COVID virus. But some people think that some of the symptoms of long COVID are caused by an exaggerated immune response to COVID itself, to the COVID virus. And so it's not a stupid question or an ill-informed question to ask about whether the immune response to the vaccine could possibly give you long COVID. But all I can say is that long COVID actually starts quite soon. It's not like long COVID is called that because it starts a long time after. It starts soon, it just goes on for a long time. And so people who had the vaccine in the trials last year have had 6 to 8 months since, and we haven't had any reports of people having these long-term symptoms after having had the vaccine. And of the several million people who had it, and that the MHRA had reports through the yellow card system, none of them had those sort of long-term symptoms. So that's what we know about it for now.
Okay. I'm conscious that we need to go into some breakout rooms, which is an opportunity for everyone on the call to contribute their ideas about perhaps what we can do to increase confidence, what sort of information might be useful to share, or if you've got some reflections on what you've heard tonight. So I'm going to move to that. I know there are questions that haven't been answered, but as I said earlier on in the call, we're going to make sure all the questions that have been put, there is an FAQ, a frequently asked questions, responses to all those questions, which we will email out to everyone who's been on the call tonight. So you're now going to be moved shortly into some breakout rooms. they're going to be facilitated. I suggest we spend 15 minutes in those breakout rooms. So those who are facilitating, if you can help to steer the conversation. There will also be a health professional in each of the rooms. So if you've got any technical questions that perhaps you couldn't put to Dr. Husbands or Professor Palmer, there'll be a chance to ask those there to health professionals or GPs in those breakout rooms. I think my colleague Matt is now going to move people to working breakout rooms. Matt, is that about to happen?
Yeah, that's ready to happen now.
Okay, excellent. And then we'll return in about 15 minutes. And if you can, if the facilitator can just feedback one key solution or issue that came up, just one, please, because we'll have several groups to get through. And then we can think about the final poll and close the event shortly after 7:30. So Matt, if you'd like to move us to our breakout rooms now. Looks like everyone's returning. Apologies if you felt you didn't have enough time. There is never enough time to talk this through, and it really suggests that we've got to do some more events like this. I think it was really good in the group I was in that people felt that this event was helpful to them in terms of giving them some of the answers that were sort of playing on their minds. Matt, I'm assuming everyone's now back from the breakout groups because we've got 18 minutes left and we want to hear one useful thing that's come from each of the groups, and that might be a key challenge or it could be a really good idea that you've discussed as a group about what needs to happen to build more trust and confidence. So I'm going to ask each of the groups in turn to give us one thing, one bit of feedback from your group. So can I go to group number 1, please? Who's feeding back from group 1? You can unmute and just let us know. Group 1? Okay, let's go to group 2 whilst we wait for group 1. Who was facilitating group 2?
Rosemary.
Rosemary, can we hear one thing from your group, please?
It looks like people are just coming in slowly.
Okay, so let's go to group 3.
Yeah, that's me.
Okay, Patrick?
So one challenge and one recommendation. One challenge was the conversations around herbal medicine, alternative medicine, and how that works alongside medications, vaccinations. Some people won't take the vaccine, they prefer herbal and other natural forms. Examples given by one person that had COVID and they were able to deal with the COVID using ginger and other organic herbs. So the question is, can you balance, do you have a choice or can you have a herbal perspective on that, despite the fact that obviously we're dealing with a massive pandemic as well. One recommendation is that people want to have more events like this. I think a lot of people found this event really positive, but they like to have the event more curated, looking at particular issues, maybe looking at alternative medicine, looking at a conversation around the whole stuff around pregnancy, fertility. So go into a bit more detail around that, more events with kind of faith communities as well. But the reason why having the event, but also having information, the information that that's culturally sensitive, that acknowledges people's experiences of mistrust, and also the point that was raised that this is not simply about ethnicity, it's also about class, because there's a lot of white working class people who don't trust the vaccine and the whole trust of the government. So it's multi-layered and multifaceted. as well. But people welcome this event and have more of these events. And I have to say, I've been to quite a few events like these, and I think having that balance between the medical, the science, and the community is the way forward.
Thanks,
yeah.
Thank you. Really helpful feedback. So, group 2, Rosemary, do you want to feedback? If we can keep the contributions as brief as possible, please. Rosemary, I think you're on mute. We can't hear you.
Unmute. Okay, cool. One of the salient points, which is something that is known within the BCS and public health and so on, is that there is not enough messaging in the Black communities. The point that was made that, Jewish communities, Asian communities, those are the examples given, appear to be very organized. But this person expressed great surprise at the fact that information doesn't seem to be clearly messaged within the Black African, Black Caribbean communities. So clearly that reinforces the need for more messaging to take place.
Thanks, Rosemary. Short and very sweet. Thank you. Can I go to group 1, please, to feedback? Who was facilitating group 1?
Viv.
Yes, echoing really what's already been stated. The main point was that there needs to be more. There needs to be more events like this. So it's very good. Patrick's point as well. Patrick Vernon's points collapsed into that. A greater emphasis on targeting our young people, and also being even more diverse in the kinds of individuals that we've got on as speakers. There needs to be more encouragement for, local influencers, people that have got a very small scope of influence, but, are very effective within that scope, being encouraged to post their own experiences and get that kind of positive flow of information going. When it talks about atypical influences within our community that are usually overlooked by statutory services and so on. Dr. Husbands talked about the kind of campaigns that government have run, identifying so-called influencers in our community that really don't have significant traction because they're remote and detached from our community. So long story short, it's a great event, more like it, and identify individuals that have got influence within pockets of our community.
Okay, and if you are one of those individuals or individuals, then I'm sure we'd welcome hearing from you. So do get in touch. You could contact myself, Matt, other colleagues on the call, drop us an email through our website, or drop the council an email. So I've got 3 more people to hear from. Can I hear from Toyin, please, your group?
Hi, Jake. God, it's good hearing everyone else. I mean, there's much crossover in the messages, so I can summarize a bit faster on some of these. So safety and trust is obviously an option, and that's come up in the discussions beforehand. There was something about us being, as a community, last in line for wanting to have the vaccine, and kind of like people not addressing this when we were actually first being affected by it during the virus stage. So there's this disconnect, which is causing people to kind of like question why now when before you didn't really care about it as a state. So there was this idea that we should get the information out in a form that's easily accessible so people can digest it, they can understand it. There's also a recommendation to push back against social media, so encouraging more fact checking, and also GPs just calling patients, asking them, if they don't take it, just, a friendly chat with them to find out if they can, get rid of any of their fears, and just having that one call. I did have something to say from my point of view, which I started when we ran out of time. I'll say it really quickly because I didn't want to get it out in the group. I think one of the things that I personally think that we're missing is that we don't kind of get the idea that we're not a monolithic community. And I think there's a big problem with that. It's not hesitancy. Hesitancy is the wrong term to define us. It's actually a choice for many members of the community. And that, I think if we don't understand that, then what happens is that we won't shift the problem, because what's happening, people are making a choice, and they might be making a choice on incorrect information, but by actually attacking them as if they're being hesitant, as if they're being irrational, when actually they are very intelligent people, they're just misinformed, actually disengages. And this is actually not a question simply about ignorance, which is the way it's been portrayed, which I object to quite sincerely about. This is actually about attacking people's authorities. So when we talk about social media, people go to particular social, what I call their social authorities. So the people know them. And if we undermine their authority or try to undermine their authority, rather than reach out to them with information, not engaging on their fears, but actually empower them with health advice, then what happens, we'll be back in a circle. And the danger of doing events like this, which are fantastic, is that we can actually end up talking to ourselves. So if we really want to break that cycle, then we have to recognize that we do not demolish someone else's cultural authority. What we do, we engage with them on a level of, this is health advice, and we're giving you this advice. If you choose not to take the vaccine, as long as you're not clinically vulnerable and you're not in one of the elderly groups, then that's a choice. I'm not going to push you on it. But that's the way we have to kind of look at it. And that's something, I don't think we have had that discussion. It's a very important discussion, but yes, I'll leave it there.
Thanks, Ty, and lots of support for what you said there from many quarters, and as always, very sensible and well-considered thoughts there. Thanks, Ty. And apologies if I've used hesitancy in my opening intro. So we've got two more groups to hear from. Can I hear from Peter's group, please?
Hi everyone. Just to say that we weren't able to get through all three questions because we had some really interesting conversations, and that was great. I'm going to hand over to somebody in our group who I think can better articulate the discussions we had. So over to anyone who wants to lead that.
I've got a feeling, Peter, that because we're in this session, only you as a panelist can...
Oh, right. Oh, okay. Right. So, well, again, I mean, a lot of what's already been said was what was discussed. It was all around the quality of information that's been made available to our communities. It was particularly how the social media is being used to not only propagate negative and information, but also how that can be converted and turned around to use as a vehicle to provide factual information. There was also considerable discussion around some of the issues around sickle cell and other conditions which affect us disproportionately or more, and how that interacts with the way the vaccine is being discussed with our community. And there was also talk about the need to have the open discussion around why we have people who are making choices not to have this. And I absolutely agree with Toyin in the sense that people have the right to say no to this. And in the context of our history and our experiences around how we have been treated with experiments, you know, we have to absolutely accept that our people have the right to reserve judgment. And that actually we need to look at our communities as individual people and deliver truly person-centered services, which means we have to respect people's decision to make a calculated decision not to have this. So there was lots of what's already been said, and they were just some of the points. I probably not articulated everything, but I think they were the things that I tried to take down as I was listening.
Thanks, Peter. I saw one person clapping, so you must have said something, right? Great, that's really helpful, Peter. And can we now go to the last group, which Jeanette was facilitating? Jeanette, have you got one thing to feedback?
I've got, yes, I'm going to close it out. I echo all what everyone said. I really echo what everyone said. We need to go on to start we need to start bringing together those people that have had the vaccine and get them out there to try and talk about how their experience is, how their experience was when they first had the vaccine and how it is with the second injection. Then they said that we need to have more conversations like this, but not open that bring more people in as well. We need to have more conversations, and they found that the whole thing very informative. We need to have more conversations, but I can't really say much on anything else because we've echoed it. Everyone said what was said in our group.
Okay, thank you, Jeanette. So we're near the end of the session. There's a few things that we still would like to do with you. We've got a couple more polls. You remember at the start of the session, we asked you, do you think you've got enough information about the vaccine? So Matt, if we could run that poll again and see if there's been a change of opinion. And then there's another poll about vaccine centres and where they're best placed. So Matt, if you could just run, here we are. So do you now feel you have enough information about taking the vaccine? Last time 52, I think 52 or 56% felt they did. So there's been quite a significant change, it seems. With just over 70% now feeling they've got enough information. So perhaps more of you will be taking the vaccine as a result of the information you've had tonight, which is good. Great. Polls ended. Right, so it's ended with 70% saying yes, they do feel like they've got enough information. Still some people who are unsure, but definitely less people who said no before, so that's great. So we've got a third poll, which is really asking you about where vaccine sites should be located. Matt, do you mind jumping that poll up? Here we go. So there are 2 pharmacies and 2 primary care-based clinics where residents from both City and Hackney can get vaccinated. People can also book into one of the mass vaccination sites. What is important? So you can answer more than one question. So if you read those answers and think, if you can click on the ones that you feel are most important to you. It looks like that poll's closed, Matt. Is there a reason why it's closed so quickly? Ah, here we go. So it looks like the most popular at the minute is people are more likely to get the vaccine if the clinic is within walking distance. So therefore avoiding using public transport. Closely behind is people are more likely to get the vaccine if it's set up at a trusted community centre. And then in third place, people are more likely to get the vaccine if the vaccine clinic is aimed at their community or branded, perhaps, in a way that's culturally sensitive. So I think quite clearly, most people are likely to take the vaccine if that site is close to you. Now, there's only 2 sites or 4 sites in Hackney. Maybe, I'm not sure if Dr. Husbands could maybe say a little bit about whether there will be more sites opening, or are we just going to use the ones that are currently there? Sandra, would you mind coming in on that? We can't hear you. Maybe you're not switched on. Still can't hear you, Sandra, unfortunately.
Can you hear me now?
Yes.
It's NHS England that's in control of whether more vaccination sites open up, and not specifically where they are, but of approving sites that are offered by local GP confederations or pharmacies. So as I understand it, they're looking for more community pharmacy sites, and so there will possibly be more of those, and we might get some in the city or nearer to the city than we currently have, and maybe some more in Hackney. I'm not clear what's going to happen in terms of more general practice type locations.
Okay, thanks, Sandra. So we're near the end of the session now. I've got a few more things to say. Firstly, if you're interested in being a champion for your community and you want to volunteer and be trained as a volunteer to provide messages, provide reassurance, give out leaflets, well, obviously not at the moment because we're in lockdown, but you're able to use your channels and you want to get more involved, then there is what's called the Community Champions Programme, which is being led by Volunteer Centre Hackney. I know Lauren is on the call, but unfortunately she won't be able to speak because she's not on the panel. Maybe next time. But Lauren, I'm looking at you and I'm assuming people can go onto the Volunteer Centre Hackney website to sign up. She's nodding brilliantly, so that's a yes. Maybe pop your website address in the chat for everyone, Lauren, so anybody who is interested in being a champion can sign up.
Jake, we can unmute Lauren, I think.
Oh, okay. If the technology is not possible, then I'm sure Lauren can just drop a note in the chat function. I think this has been a fantastic event. I think it's been hugely informative, useful. I'd like to particularly thank Dr. Husbands and Professor Palmer for their very knowledgeable answering of the questions. I know not every question was answered, but as I said, we will endeavour to ensure we release a frequently asked questions crib sheet with all the questions that were put and the answers as best as we can answer them. Clearly there is a need to do more events, so we will go away as a team and have a think about how we best do that. I'd like to thank our panelists today who provided some really useful wisdom from their perspective. They're out in the community working on these issues every day, so it was really helpful. I think we had over 300 years worth of knowledge amongst the panelists. That's nothing about their age, by the way, but you know what I'm saying. I'd like to thank those that were involved in putting the event together behind the scenes. It's been a lot of work and we only decided to do this a couple of weeks ago, so it's been quite a rapid paced preparation that's gone on behind the scenes. I'd like to thank everyone that contributed to the conversation. Clearly there's more that we need to do to give people the knowledge to make informed choices. Hopefully you will find you found this event really helpful and you will go away and talk to your family, talk to your friends about what you've heard tonight. And if you want to get more information, then just drop us an email or go onto the council's website. You can actually engage with people that way. Clearly we need to do a lot more events, however. We've only scratched the surface of some of the issues today, and I know that many of your concerns are extremely valid concerns that we need to unpack further in the future. So on that, I'm going to close the meeting and do one more thank you to everyone. And we'll be back in touch. We'll be sharing the slides, sharing the frequently asked questions. And if you have ideas and thoughts about what you would like to do to help get messages and get people the information they need, then please don't hesitate, get in touch with us. If you go on the hcvs.org.uk website, we're actually offering community groups grants to be able to be part of the solutions going forward. So if that's you, please do get in touch. And obviously we want to ensure that money reaches the groups that can support communities that are most impacted by COVID. So can I say a big thank you finally to everyone, and I wish you a safe and happy life, and hopefully we will be out of lockdown soon. Okay, please, please, please do what you can to be safe. So thanks, a big clap to everyone for being involved. It's been a great event.
Sam, I'm coming to yours.
Thanks everyone. Take care.
Thank you. Bye.
See you all soon.
Bye, Jake. Bye, everyone. Bye, everyone. Bye.